Ayurveda and naturopath and in acupuncture from last 22 years. So in my observation, I see there are so many diagnosed and all the things, but main things the people are not giving to each others. In recent time, in recent time, Ayurveda is very big influence of India. So our elders and our ancient members don't share their knowledge to each others, but at present time I want to share all the knowledge with you all. So first of all, we have to necessary to know how body works. In our body, you see, our body is a very great creation of God. In this our body, there are so many pathways, there are so many roadways, roads and railway tracks and aeroplane airways in our body, because there are arteries, veins and nervous system, all are different. Veins and arteries are like roadways and railway transport, and the nervous system is like a aeroplane, or you can say airway system. But you see, in every system, if there is no blockage and there is no distractions in the way, then everything is going fine. On the roads, you see, when there is a accident, the full road is blocked and so many people are disturbed. In many times you read in newspapers and in other channels and other social media platform that there is a heck jam on road jam for 17 hours and more than it. So it is a blockage and distraction in the way. On the same way, when in our body there is restrictions in the arteries, in the veins and in the nervous system, then there are diseases. So almost one thing in our body that is very necessary to you now, that is posture and body shape. So how you can diagnose with the body shape and posture? And a strong and steady bodies, if you see a person have a strong and steady body, then there is a strong constitution of chi, and good jing tends towards chi and balance. Then his body is very good and very nicely. Weak and fragile body, when you see a patient is very weak and the body is very fragile, then there is weak constitution of chi. Then there is the chi. Chi means urja, electricity in our body, because our brain is a reaction of chemical and electrical combination is a brain. So weak jing and tends towards show imbalance. Show means blood. There is blood imbalance. When you see a pear shaped body type, then it means yang shu. The blood is more young. Then spleen chi shu. Spleens chi shu and damp phlegm. There is phlegm also. When you see shaped or Tai Yang type body, Yang Si, that is significance is Yang Si. Then you see very thin and wiry, very thin body structure. Then there is Yangtze. Then the body is constitution of very young type, and it is more acidic. When thin and wiry or Shaoyin type body, then there is Yin Shu. Blood is Yin. Blood is very cold, and Shu is blood is in a solo follow. So when you see a person in very overweight or plump, then there is phlegm and dampness. When you see a patient have a stiff and rigged posture, is like this, is body structure is zigzag, so then there is liver chest stagnation. When you see a person have very weak muscles and all, then there is the liver chest stagnation. In this way, you can diagnose according to body and postures. So if you know how to diagnose and you have a good diagnostic tools, then it is very good for you all. Then for diagnose pillars, there are 5 main pillars in diagnose, because our body is made by 5 elements. Those 5 elements are you all know: wood, then fire, earth, metal, water. Okay, so when you know everything about all these 5 elements, then you have a good diagnosis. When you see a wood type body, then sinewy, grainy skin color, then small head, then long face, broad back and shoulders, stick back, a straight back, small torsos, tall, very tall, small hands and feet, intelligent, not physically strong, present when they work, presence when they work, tendency to worry. They are always thinking, and always they are more worry about the things. So it is the type of wood type of bodies. Next, for fire type body, then you see a fire type body means then they are ruddy skin colors, small head, thin face, wide back, then well developed muscle in the shoulders, back, abdomen, and buttocks. Well developed. Then small hands and feet, curly hairs, quick tempered. When you see a fire type man, they are very quick tempered. Something is happen and they got immediately tempered. Quick thinking. They are think immediately. Then quick body movements. They are very active in body movements. In working style, they have a very good working style. Then frame get. Their get means the body postures. Get. I will tell you about get. There are so many patterns in get. So can have a tendency to be anoxious. Next, the body type is earth type, and earth, you know, earth is very important organ, and in our life, you see, earth is also very important for us. And how many the structure of earth in our body? In this word, you all know 21. I think 21% only earth, and remaining is water. And there are so many pupils and so many words, so many living hoods, and all are eating from this earth. Earth is a mother. Who is earth? Earth is a mother because it creates nature. If you see, there is no earth, or there is no plants. In water, there is no plants and no foods. So earth is very important body structure, and earth represent in our body muscles and all things. Yellow is skin color. When you see a man's face is yellowish skin color, then returned body shape, large head, round face, broad jaw. Jaw is very broad. Then large abdomens, large thigh and calf muscles, strong legs, relatively small hands and feet, well proportioned body, a steady gait, then rise with slightly weightless walking, solid muscles and all. Then metal type body, you all know. In metal is a water element, like a water element, and it is a metal. So metal means dhatu. In our body, that is called sperm and ojas. That is metal. Then pale and skin color, square face, small head, narrowing shoulder and upper back, small abdomen, lean, small hands and feet, all type of this diagnose. Then we go for water type. It is a dark complexion, wrinkled face. When you say if patient's face is wrinkled, then immediately told it is water type body. Then large head, angular jaw and thin, round and narrow shoulders, large abdomens, move and whole body and they walk. Long spine, relaxed, loyal, alternative and sensitive. So after that, you can do a visual diagnose of a person's moment. How you diagnose a person's moment when he's walking, he is doing work, then body movements, if observation, if the rapid, if the patient is very rapidly working and very rapid in speaking and all things, then it is a heart, it is a heat significance, it show heat. Then quick and nervous, then it is yin and blood heat. Quick and forcefully, then it is so heat, means restless, then it is also very heat in body. When you have a patient, he complain, I have no sleep in nights, I have no rest in my mind, then that is the heat type body. Then how you control it? So for body heat, I told you one thing. Whenever you see a patient, those have body heat, then you immediately do bloodletting. The bloodletting control the blood heat and body heat. And for this purpose, ST44 point is very good. Okay. Slow and stiff cold, Landric weak and slow, Chi Shu and Yang Shu. So stiff and limited, it is called Chi stagnation, Shu stagnations. Then gloomy signs. Gloomy signs means it is very Clemens, so liver chi stagnation and phlegm is high. So for phlegm and body chi stagnation, you use liver 3 point, and for phlegm, always bleed ST40 because it is a very big point for all type of phlegm problems. So a heavy and procedures, then dampness and phlegm. On this time, if you find this condition, then you have to use ST40 for bleeding, and for dampness, you have to use PC6 and liver 3. Persons for when you see the color of clothes and all, so this type of diagnose in your life, when you see a patient that have a problems, when you see and you have a good diagnose, then you can immediately told him or her, you have this problem, then automatically 50% he is cured by emotions. Immediately he is cured by emotions and all things. You see, when a patient enter in your office and you see his foot is pronated, then you see you have knee pain, then patient say okay, then after that you can say immediately you have constipation, then patient have already constipation. When a patient you see those have constipation, they have high phlegm in lungs, and they have asthmatic problem and breathing problems. So in this way, when you talk with the patient, then he immediately catch you. He think you have a good diagnosis, so you have a good knowledge, and you can treat him very well. So it create a confidence in patient's mind. And I told you, in old age patients, 85% patients are emotionals, and they have a worry about caretaking. So when you see a patient, those have a caretaking problems and all, if they are sharing with you the problems, I have no caretaker, and I am not now, what happens to me in next time. So that time you gave him one homeopathy medicine, Ignacia. Ignacia. It worked very well. You can use, if you want to use only one time, then you use always 1 m dose, no problem. Okay, it is giving a patient, when a patient have a fear or fell down, and he is thinking, if I fell down, if I stand and I fell down, then you provide him Ignacia. So these are common complications in our clinical practice. After that, you treat the emotions and all things with the a very same things. When you see the constitution of wearing lots of clothes, then how you observation a patient's significance is young type or young type, then showing wearing of clothes, then a patient is wearing a lot of clothes, and he have cold and young shoe. Okay, he have cold and young shoe. Blood is hot, but he have young in blood, but he have cold. So he have trembling and all things. His body is very cold. So wearing little clothes means heat in the body. There is heat. Then dreminous clothings seen disturbed. Then he is wearing the clothes not properly, and he is not wearing clothes according to combinations. Then he is mindly disturbed. Then very present clothings. When you see a patient have very good clothes, and he is very aware about the clothes wearing and fashions, then he have the liver chi stagnation, prominence of a particular color. There is shoe condition, blood condition can be a sign of blood condition of jang organs and restored. So in this way, you can observe a patient with the clothes. For visual, when you see a face, according to body movements and body face, when you see white face, then it is mental constitutions and imbalance in the mental in metal face. When you see blue and black complexion on the face, then it is water constitutions or imbalance in the water phase. When you see a red face, then there is fire phase. When you see a greenish face, then there is wood phase. And when you see a yellow, then there is earth phase. So in my clinical practice, I always see the patient's face and clothes, and after that he is sitting, then plus diagnose and all. But without plus diagnose, when I told you have this problem, then the patient is very satisfied, and he always positive. Because once your patient think positive, and already there is a neurotransmitter in the brain. In our brains, you know, there are 14 neurotransmitters, and doing work according to our thinking. If you are thinking good, and you are receiving love from others, then there is dopamine. If you are getting threatening from others, and bad behaviors and abusing from others, then you have a young constitution, and it will create acetylcholine. So in this way, the emotions are very effective in our diagnose. And when you say a patient, you have this problem, and he is very happy, uh, then his mind release dopamine, gabapentin and all. So it give more confidence to patient. So more confidence always good for good treatments. So in my clinical practice, I am doing almost scalp acupuncture, and now I am teaching in Nigerian students. More than 350 students I have from Nigeria, and they are my regular students, and they are learning all the skills of acupuncture, naturopath, and Ayurveda, and homeopath combinations. Because there is no cure in one treatment and one pathy. If you are a healer, if you are a practitioner, then by hook or by crook, you have a aim. I have to treat my patients. If my patient is not got cured with body acupuncture, then I do scalp acupuncture, then I do naturopath, then I do homeopath, then Ayurveda, by hook or by crook. Which system is good? Always follow that system. So in this way, always remember a good diagnose. You can take a good diagnose. So in most disease, most complications on the body, and there are two muscles. I told you, one is gluteus maximus, and second is iliopsoas. There is many books on vital power of iliopsoas. So iliopsoas muscle is a very important muscle in our body. It treat all the abdominal activities, and it treat all the core muscles. So when it is tight, then there is back pain, knee pain, sciatic pain, infertility, impotence, then constipations, appendix, all type of disease reoccur with the imbalance of sciatic nerve. Imbalance of iliopsoas muscle. When iliopsoas is very tight, then gluteus maximus is very lengthened. So at this time, there is working the fascia. The fascia connected to muscles, and a very thin layer of white color that is attached with the fascia, muscle to muscle. In this way, the one muscle is connected with the other muscles, and the other muscle connected with the other muscles. So in our body frequencies, you see the roadways. I am telling in starting of the class, there are highways in our body. So when you see one fascia is going here, then it is going laterally on this side and this side, and it is going downwards on lateral body side. But when you see on front side fascia, and it is going on front, it is going like this, and from back side fascia, it is going from back side. So from backside fascia, how many in this class those are using tongue acupuncture or any other acupunctures? Dr. Vamsi?
Yes, sir.
How many doing acupuncture in any system?
Okay. Friends, anybody doing acupuncture, you can unmute and say which type of acupuncture you are using. Scalp, auricular, or which type of acupuncture you are using. Just it will be interactive. You can ask doubts in between. You can ask the doubts related to the topic for health issues after 8. You can ask the health issue after 8. Regarding to the topic, you can ask now. You can unmute and talk now. Ishwar Reddy sir, acupuncture.
Okay, then I think you are using tongue acupuncture. Okay. So in tongue acupuncture, what is the important? When you are putting needles on Achilles tendon, the points 77.01, 2, and 3, then it treats the neck problems.
Yeah.
What is the reason?
Sir, if you cannot talk, you can text also, no problem. You can text.
Okay. So, how it is working? It is working through a fascial line. When you are putting needles on Achilles tendon, then this area's fascia going to directly on the back of head, on this area.
Through nervous
So-
system. Through nervous.
Not through nervous system. It is going through facial line and facial system.
Okay.
Okay, because if you are using UB62, then you can say through nervous system,
Yeah.
but there is not a nerve. There is only fascia. Fascia
Okay.
is very important in our body, and fascia is a
Yeah.
structure of jelly mass. So in full body, it is like a spider's net in our full body. When you are
Yeah, yeah.
treating one area's fascia, then it treats the full line.
All right.
In Tung's acupuncture, you see top treat the bottom and bottom treat the top. Then
Yeah.
face treat the
Hmm.
face treat the full body.
Full body. Yeah.
Okay, but left treat the right, right treat the left.
Right, it's left.
Then
That is
bone
that is
treat the bone, skin
Yeah.
treat the skin. Okay, it is going through the fascia.
Yeah.
Then you see when there is a facial line, you are going almost using the point in Tung acupuncture. There are 22.08 and 9.
Yeah.
These 2 points you are almost using for back pain.
Yes, yes.
How it is working?
Through fascia.
Through fascia, not through nerves. Because here's nerve is going only brain, directly on the brain.
Yeah.
But when you are using this fascia, then it is going directly here, and it's joint on here with the muscles fascia of latus dorsi, and it
Yeah.
goes directly on lumbar thoracofascia.
For frozen shoulder also we can use the facial line treatment.
Yes, yes. Because for frozen shoulder, you are putting needle on this area, or you
Yeah.
are putting the needles on A04.
Yeah, yeah.
So this fascia going directly to here
Yeah.
and with latus dorsi. Then it open all the fascias and activate the fascia.
Yes.
It is the region of working.
Yes, sir.
So with the good knowledge and with the good diagnose, when you are practicing, then you have a good practice and good name and fame.
Hmm.
So Acharji, I request any diagnosis. You said the diagnosis was an important things for every patient. So any diagnosis techniques to our therapist, how to diagnose, some simple tips on techniques or something, how to diagnose the patient once he come to the
Okay.
our clinic
True.
or things.
I told through the posture.
First, okay, right.
Posture is the main thing in our body. There is no pain if the posture is very correct, and then there is no pain, because if the posture is very straight, then no muscle is contracted or no muscle is lengthening. When a muscle is lengthened and one is contracted, then it creates pain because it is bending like this. So it creates pain. Imbalance in the muscles tone is a pain. When there is an imbalance, then there is a disturbance in blood flow and nervous flow, nerve supply and all. That is the reason there is pain. Because you see, when a patient is walking, and come with you in your clinic for back pain. Now he come for back pain, then you put automatically the needles 22.8 and 9 Li4, and then 22.6 and 7 and 4 and 5. Okay, then you local needling, everything, but the pain is not going. After 2 sitting, 3 sitting, 4 sitting, he's complaining the same thing. Why the pain is not going? When you are putting needles, the pain is going and subsided, but after 2 hours, 4 hours, it will come back. Then it is the reason because there is imbalance in the hip joint. The hip joint is not proper. Your pelvic floor is not proper. And when you are going with diagnose, a good diagnose, when the patient is coming, then first of all you see shoulders height. It is equal, or it is one is down and one is high, like this. Then hip also like this, up and down, slightly up and down. Then see the valgus knee and varus knee. Valgus knee means the knees are sitting joint with this, and leg are like this, because because of the pronation of foot. The patient's foot is putting like this in inner side. Then the patient is putting pressure on this area, then it will be flaccid. The arch is collapsed, and automatically the tibial bone starting rotating inner side. Then tibial bone also rotate, then femur bone also rotate. To control this moment, the pelvic floor also rotate, and to control all these moments, the iliopsoas is tight. If you know only and only how to release iliopsoas muscle, then you can treat so many patients without any needles and without any other things. Only release the psoas muscle. It give very benefit to the patient. And when the hip alignment is not good, and it is up and down and lateral tilting in hip joint, then it will take time. But first of all, when you start working on this thing, then the patient got good results, and he will give you a good name and fame. Because in a simple way, when a patient saying to other patient that doctor is good, then it is a doctor's and a healer's real respect, because he thinking you are a good and you are like a god. So always keep the patience and keep the belief on God. So in this way, when you see, now I am telling you about scalp acupuncture. Why is scalp acupuncture more powerful than all other techniques? Because scalp acupuncture is all the areas in the brain and nearby the brain. According to neuroscience, here is a line area, pre-central gyrus and post-central gyrus for sensory area. So in this way, I am not going for this way, but I am telling you, here is the mostly fascias are connected with hair. You see, when you see any image fascias in Google Map, Google, then you see all the front fascias are coming here. Then side fascias are coming here. Okay. Then back fascia are coming on up. So all the fascias are connected with the scalp. So when you are putting a needle here, then it immediately reflect on the fascia and it treat the problem. I think scalp acupuncture is 100 times better than local body acupuncture. Okay, so I am saying only one thing. You learn all the good things and all techniques. I'm not saying you learn from me. There are so many good teachers in India and in abroad, but I am saying you only one thing: learn good and do good. Respect the knowledge and get respect. Because if you are getting good knowledge from anywhere, it will be more useful for you. With the less knowledge, it is not good for you.
Acharya sir,
So
we can move to the doubt session, and tomorrow also we're having class. So
okay.
okay, right. So you can unmute any doubts to the subject or your health problems. You can discuss now. You can discuss. Start discussing. You can unmute. If possible, come to the face also. It will be easy. If not possible, voice or text. So, but in English, but he don't know Telugu, so you can ask in English.
Namaste, Dr. Ji, Acharya Ji.
Namaste.
For diabetic patients also we can cure with scalp acupuncture.
For diabetic patient, I am telling you very simple technique.
Yeah.
It is a digestive problem.
Yeah.
And due to weak immune system,
yeah,
it create a high. Okay. Then you advise to your patients rectal irrigation. Okay.
Okay.
One time in morning and evening on both time. Within
Okay.
15 days, you see there are very good results.
The rectal irrigation, how many times we have to do, sir?
If they are doing real rectal irrigation, there are two things. One is enema and one is rectal irrigation. Okay.
Yeah.
When you are providing enema to a patient, then it in laying position.
Okay.
And you put 1.5 liters and 1200 liter
ml
water.
Yeah.
Yes. Okay, in one time. But
Yeah.
when you are giving rectal irrigation, then the patient in a sitting position.
Yeah.
Okay, in this system, you give only 300 waters in a time.
300
and
ml.
the patient have when patient intake 300 ml water through the rectal, he have a sensation through the sacral nerve.
Okay.
Then there is a parastatic movement are started, and it regulates the parastatic movements again and again.
Okay.
So advice to patient, not remove the catheter and always use 14 number catheter.
14 number. Okay.
Yeah, urethral extension 14 number.
Okay.
Okay, then you treat according now Yamamoto scalp acupuncture. Then you can treat spleen point on Y spleen,
Yeah. Spleen
or
point.
cranial nerves.
Cranial nerves. Which nerve, sir? In cranial
Stimulate
vagus, sir?
vagus and cranial.
Yeah.
Vagus nerve, then First, olfactory.
Olfactory. Okay.
Oculomotor. Oculomotor.
Oculomotor.
Yeah. First is I think oculomotor.
Yeah.
First and second, both are using for kidney and urine bladder.
Okay.
Okay. First
Yeah.
and second, and then 10th cranial nerve.
Yeah. But this is related to digestive system, na?
Yes, yes. But
Yeah.
in this system, when you're doing vagus nerve is a nerve that is a sympathetic nerve.
Yeah.
Okay. So it balances everything.
Okay.
And for treating, if you are treating any patient, then you should treat kidney always,
Yeah.
because kidney detoxify our body.
Yeah.
That is the main thing.
Even liver also?
Yes.
Okay.
Okay. Then you check the BP
Yeah.
of sugar patient. If the difference in systolic and dystolic, if the difference is more than 50, then it may be a sugar patient. If the
Yeah.
difference is 50,
Mm.
okay, then it may be a patient of undigestive problem.
The difference between 50,
Yes.
that is, he is sugar patient, huh?
Above the 50.
Above the 50. Okay.
Yes. Then it is sure. Then
Below the
provide
50,
him.
digestive.
Then provide him. If you are giving to give him the herbs, then provide him good mar. Then not provide him salt before and after half hour
Okay. Okay.
of giving
No
medicine.
salt.
No salt.
Okay.
If you are putting
Okay.
salt, then there is no use of any medicine.
Okay.
Okay.
Thank you. Thank you very much, sir.
Okay. Always welcome.
For back pain, they're asking about the back pain.
For back pain, I told there is many diagnose for back pain. If there is muscle stiffness, then it is very easy to cure. But almost I told you the vagus swas muscle. When they open swas muscles, then the back pain also gone. The body posture is very important in this condition.
What's a swas muscle?
In in muscles, swas
Throat.
muscle is front muscles. I show you.
Okay.
In this area. From
Okay.
here,
Okay.
from L2 to it starting from L2,
Okay.
lumbar 2, 3, 4, and 5, and then it is going on front side on this area.
Okay.
And it joint inner with the inner hip area.
Okay.
It is greater truncator and inner side of this. It is joining. Okay. So this muscle is when tight. Okay. Then the patient is not flex the full not length like this. Always the leg is up like this. There is gap. It is always like this.
Okay.
Okay. When the patient is walking, then he is flexing like this.
Okay.
Somebody's flexure is like this.
If the inner hip is like tightness, then how we will make it free?
By compressing the swas muscles.
Okay. Okay.
Okay. For that, I will show you how you can release it. Fold the leg like this.
Yeah.
Then you stretch these muscles.
Yeah.
Like this.
Okay. Okay.
It is very painful.
Yeah.
But after you putting pressure on this, and when the patient is stand, then he is very relaxed.
Okay.
Okay. Only this muscle is very good for all type of back pain and all. Second, see how is leg length and other symptoms like valgus knee, then quads dominance, and then anterior tilting, posterior tilting. There are so many things in back pain. If I told you you use in Yamamoto D point, then this point in tongue acupuncture. 22.8 and 9 Li4. Okay, I already told you. When you are not going for a good diagnosis, which muscle is weak, then you are not cure it. So I recommend one book, Postural Correction.
Yeah.
When you read a book for postural correction, then it is good for you.
Tell the name of that book, sir. Please tell the name.
Postural correction.
Postural correction. Okay. Author name, sir? Author name?
Author name, 1 minute, I tell you.
Or if you have any image, please send.
Yes. Jenny Johnson.
Johnny Johnson. Okay.
Jane.
Jane.
Johnson. Jenny Johnson. Postural correction.
Okay.
It is a very good book for all type of postural correction. In this book, they told you which muscle is weak and how you treat it.
Okay.
After reading this book, you can treat the motor point with the acupuncture, and then put electrical stimulation. Then it create stem cell in body. It is a research on the points when you are giving electroacupuncture, it will create a stem cell.
Acha.
But in allopathic, when you are taking stem cell, then it is more costly than 1 lakh per setting.
Yeah.
But our body create the stem cells when we are putting electrical stimulation on the motor point.
Yeah.
Okay. Then so every muscles have a motor point.
Yeah. Motor point or water point, sir?
Motor point.
Yeah. Right. Thank you.
Motor moment. So for motor point. And there are so many books.
Okay.
But this book is very good book.
Yes, sir.
Any other question?
So you can unmute and ask, otherwise you can text. Any doubts today's subject or any disease related?
If you are not understand with me, then please tell me.
No, sir, we are understanding.
Because I am telling you the truth, because I am from North India, and we have a language of Hindi almost.
Yes. Okay.
If I have to teach in Hindi, then I have no problem.
We are understanding, sir, your English, no problem.
Okay.
For this electrical stimulation, shall we give on scalp also, sir?
Yes, you can give, but not more than 5 hazards.
Okay.
Okay.
Okay, sir.
So they're asking some doubt. Foot, you check, sir. You check in the chat box, Acharya.
1 minute.
You have to check in between the chats also.
Sir, L4-5 back pain left side. Then if the left side is pain for L4 and L5 back pain left side, then there is correction. It is need for correction of pelvic floor. It is lateral tilting in the pelvic floor, and quads lumborum is very strong. So advise the patients on which shoulder is down and which hip side is up. Then told to patient do like this. This type of stretching gave him relaxation. On another side, like this. Because these muscles are quads lumborum. From here, it is very tight. So the hip is on upper side. It will give him so much relaxations.
BP point. They're asking BP point in which type of therapy will be getting good result. BP point.
1 minute.
Yeah.
For BP point, always use bloodletting on ear apex. If there is a high BP, then always use ear apex bleeding. That is very good point. This area. And when you see a patient have a morning sickness and in morning have vomiting sensations, okay, vomiting sensation and all, then you use ST44 point. It is very good point for morning sickness and vomiting and migraine in morning time. Then ST44 bleeding. For sinus problem, you can prick tip of nose. Sinus problem and sneezing, you can bleed tip of nose. It have very good results. I always use this point for a sinus patient.
So on tip of nose, just we have to prick, sir.
Yes. First of all, it
Pressing.
you squeeze like this and warm it, then prick it.
Okay. Okay.
Then help to blood come out like this.
Yeah.
So in one treatment you can cure of sneezing problem.
Okay.
And sinusitis problem. When a patient is advised for surgery, you can treat him or her, no problem. Only with one needles and one-time needles.
Shall we do for any treatment for goiter, sir? For goiter.
Goiter.
Hard swelling below the neck.
Yes.
Yeah.
I will provide the protocol, no problem.
Okay, sir. Thank you.
Because in India, in North India, I have not seen so many patients. Only 2-3 patients I see in my life.
Okay.
In North India.
Yeah.
But in foreigners, it is a major problem. In Nigeria,
South India also, In South India also we have problems, sir. Thyroid problems.
Okay. One, sir, burning sensation from throat to mouth. It is a symptoms of high yang. So bleed the nearby area of ST36. If you not want to bleed this point, then you provide him Sitopladi Churnam. Sorry, Vasa Avleha.
Home medicine also we can give for this, sir. Carbo is like that.
I am not now about much homeopathy because in my clinical practice I use Pulsatilla, Rostock, Bronia, and Ignatia, then Nux vomica,
Okay.
Plumbum.
Mm-hmm.
Colonate. Okay.
Okay, sir.
So in this way, you can use all these things. Then for when you see in leg pain for L4-5 or any sciatic pain, that is coming from top to down. Top to down. Then you use medicine in homeopathy, Calmia, Calmia, Calmia 200. Sorry.
Many patients are complaining about numbness in foot, sir, and burning sensation, numbness. For that, what we have to do, sir?
Then prick the foot fingers.
Yeah.
That is good solution.
All toes we have to prick, sir.
In front of that area.
Okay.
If you need all, then you can need all. You can do all. Then I write Calmia and Colosynth. Colosynth 2 and you can provide on the patients those have the pain coming from up to down. Then you use these two medicines in homeopathy. For all type of gas bloatings and all, when you see a patient, then first of all you see the purple color veins nearby area of 36 and 37. Stomach 36 and stomach 37. See any purple vein bleed out, then all the problems gone, immediately gone.
We have to prick on purple vein, sir.
Purple vein.
Okay. We have to prick.
Yes, prick and bleed. Any other doubt?
Sir, left nose polyp, sir. What is the protocol, sir?
I told you for bloodletting.
Okay. Okay.
It cure very well. Then you add Li-20 and in tongue acupuncture 10-10-22. 10-10-22.
Thank you, sir.
So any new people actually new to this class and new to this profession also, you can ask your general question. You will explain according to new people who are new to this acupuncture line or already suffering with disease.
For coughing, for cough problem and for all type of chest problem, first of all, you see the cubital fossa. If you see any purple vein nearby the cubital fossa, you bleed out. Make a rule for chest problem and upper limb problems. Search any purple color vein or any other color vein in cubital fossa. For lower limb problems, for back pain, sciatic pain and all, use UB40 area. Nearby the 40 area, then ST36 area, if there is any purple vein, prick out. It will be very good results in all type of pain. For back pain, knee pain, then sciatic pain, and you are using for cubital fossa, then it is good for shoulder pain and cough, bronchitis, asthma, and all problems. Any other question?
Sir, one more, sir.
Yes.
Hello, sir. Right ear backside excess growth, sir. How we cure it, sir? Backside ear excess growth.
Yes. Excess
Backside
growth.
ear
Yes.
excess growth. Excess
Yeah, yeah.
growth.
But it is I'm not say for what is the region. Okay, so
Reason is once time one goldsmith is spoke ear, sir, for wearing ring. Then it's
okay,
then growth backside, sir. Excess growth.
okay. On earlobe
Earlobe. Up.
Earlobe excess growth.
Yes. Not ear. Up. Just up the earlobe. Yes. Yes.
Okay.
Yes. That is
Here
correct
in
location.
front. Yes, yes. Okay, in front of this area.
Yes. Sir.
Then here is more growth.
No ear, sir. Female, sir.
Okay. Then if you are putting on it bloodletting, then I am not sure it will help because can you provide me a picture?
Yes, sir.
You take my
Sir,
contact number and provide me a picture, then I will tell you.
Okay. Okay.
Without seeing, I am not able to say anything.
Okay.
please
Okay.
tell your number, sir. Please tell your numbers.
92270
9
2270
70
Hello.
9 2.
సంతోష్ ఫోటో పెట్టు, ప్రియది పెట్టమంటుండు
9 2
ఫోటో. మీటింగ్ లో పెట్టి నాకు కాదు, నాకు అందులో పెట్టి నీకు
9
రాదు.
599.
సరే
599 922709259.
जी 922709259.
Okay, sir. Thank you.
Okay. For hemoglobin on the same patient or different patient? Dr. Uday, you are asking me all the symptoms for one patient or all the patient are different?
Different patients.
Okay.
Anemia, diabetic patient.
How to improve
Diabetic
anemia?
patient.
How to
Okay.
improve the hemoglobin?
Use SP4.
Sir?
Use SP4, spleen 4.
For hemoglobin, sir, to improve hemoglobin.
Fine, sir.
Yes.
Only pick up.
Yes, yes. I am telling point. SP4, spleen 4.
The prick needle or prick
Needling.
needle. How many days, sir?
On both foot.
How many days?
Alternate days, approximately for 15 days. And you provide them ricin, black ricin.
Yes.
In north, it is called munakka. In south, you called it draksha, black draksha.
Yeah.
There are dry and there are seeds in that. So seed remove. Then you start using the draksha. First day 3, one in morning, one in evening, and one in afternoon. Okay. Next day 2. Third day 3. Fourth day 4. Fifth day 5. Then sixth day 5. Seventh day 4. Eighth day 3, 2, 1. Like this.
Only one draksha.
పెట్టడానికి వచ్చిందా, పెడుతుందా?
Only one grape, sir.
First day you gave 1, 1, 1.
Okay.
Second day you gave 2, 2. Third day
Okay.
you gave 3, 3, 3. Fourth day 4, 4, 4. Fifth day 5, 5, 5. Then sixth day 6, 5, 5, 5. Seventh day 4, 4, 4. Okay. From
Okay.
starting it from 1 in morning, 1 in evening, and 1 in afternoon. Okay.
One
Then
grape morning, one
next
grape
day,
afternoon.
Next day you increase in 2, then in 3, 4. Okay, like 5.
3 times per
After
day.
5, next day you reduce it with 5.
So one grape morning, one grape afternoon, one grape evening, like that, sir.
Not grape, dry. It is
Dry one.
dry.
Dry grape.
Yeah.
Okay.
Okay.
Okay, sir.
Put it in water and
Yeah.
give it.
Only one morning, one evening, and afternoon, like that.
Yes. On first day. On second day,
Okay.
2 in morning,
Okay.
2 in afternoon, 2 in
2 in
evening. Then
Okay.
third day, 3 in morning, 3 in evening, 3 in
Okay.
afternoon. Then 4, then 5. After 5, next day you provide 5, then 4, then 3, then 2, then 1.
Okay.
Do for 10 days.
Sir, before meal.
Okay.
Before meal.
Anytime.
Anytime.
No need of
Okay.
any restrictions.
Okay,
It is only 1.
Okay. Thank you, sir.
Next day it is 2. No matter.
5 2
And
times.
second thing, you see if the patient have constipation. So first of all, provide him rectal irrigation. Then it will be work.
సార్, ఇది
Okay.
చెవు వెనకాల గ్రోత్ అన్న కదా, అది మాకు దీంట్లో పెట్టనీకి రాలేదు. మీకు స్క్రీన్ షాట్ ఇచ్చి మీకు పెడతా. నేను దాంట్లో ఉన్నా, దాన్ని మీకు పెడతారు. ఆయనకు పెట్టాలనా? అచ్చా.
So what about lipoma, sir? Lipoma.
Lipoma, I can treat, but I can send you protocols, but without training, a proper training, you cannot treat it.
Okay, okay, sir. There is no pain, there is no hardness, only lump size is there.
Okay.
Hardness,
Then
light
you send
hardness.
me image, then I told you, no problem.
Okay, okay, sir. Thank you.
Without seeing lymphoma is not
Yeah,
easy.
yeah.
Sir,
Now I told you, you pre-out it and bleed it, and you do it. If there is any mishappening, then you told. Acharya told me.
Yeah.
So I am not saying you. And second thing, I am telling you all of you now, the acupuncture is recognized in India as a independent therapy in
Yeah.
September 26, 2024. So prepare yourself as a good doctor.
Yes, sir.
Okay, don't fear about anyone. Okay, because we have right. So do initial certification and all.
Yes, sir.
Okay.
Okay.
If you need any help, then I will provide you. No problem.
Thank you, sir.
Okay, sir.
triglyceride or cholesterol controlled.
Yes, I told you about bloodletting, ST40, stomach 40. When you bleed nearby the veins, ST40 area, not on proper ST40, a nearby area, it will decrease cholesterol, and it will remove and eliminate the tumor anywhere in body.
How many days?
First of all, you do for first, then after 1 week, you can again bloodlet it. Then after 1 month, you can bleed it. Because you are doing bloodletting, so it is not regularly. If I told you, you put needles on every day, that is not good. I'm saying you, for high cholesterol and tumors, and for phlegm, any type of phlegm in anywhere in body, there is a phlegm, then you treat ST40. Because I am not now, you are listen about a man, Dr. Sebi,
Dr.
African
Sebi.
doctor, Dr. Sebi. He
Okay.
always say one thing: all the disease occur by the phlegm. So
Okay.
first of all, you treat the phlegm, then all the disease gone. Do you remember their principle?
No, sir.
So, that is the principle. First of all, you remove the phlegm, then all the disease gone. Anywhere in our body, there is phlegm. When you have constipation, then you have coughing problem. So there is phlegm. When you have piles, then there is phlegm. When you have a tumor, then there is a phlegm. When you have sinusitis, you have phlegm. When you have a high cholesterol, then there is phlegm. So always use ST4 for phlegm type. Okay.
Day by day, sir.
Yes, day by day.
How many
Not
days?
every day. Not every day.
Which days, sir?
After 1 week.
1 week,
First
day by day.
treatment you gave, then next week you gave for bloodletting. Then on third week, if it is very necessary, then do. Otherwise, do after 1 month.
Okay, sir.
Okay.
Thank you, sir. Thank you.
Okay, sir.
Okay.
Manu, sir. Again, tomorrow we'll meet.
Thank you.
Thank you to
Okay,
all.
okay, thank you.
Thank you, friends. Thank you. Bye. Thank you.
Okay.